Thank you, Rabbi Krauss. I also just wanted to add two other names. Dr. Judah Firestein and Dr. Nimrod Dayan have also been helping. Also, just so everyone knows, the administration has been fighting behind the scenes to really advocate for the school, and they're doing an amazing job. So just thank you to the leadership of SAR. I want to give some background about coronavirus. It is being treated in the hospital a little bit like an airborne illness, meaning they have to wear certain types of masks, or specialized masks. But in general, what we know of it is that it is more as a respiratory droplet type of infection. What that means, if something is airborne, someone coughs and it stays in the air. And that's why the masks are important. Measles is like that. Tuberculosis is like that. But we do not believe coronavirus is like that. We believe it is a respiratory droplet infection. That's why washing the hands is important. Someone coughs, it goes out around 3 feet, it then settles. And so it could settle on the floor, it could settle on the counter, it could settle on a doorknob. And that's when you touch it. If you then touch your face, touch something else, you are then introducing it to yourself. So the mask is less important. That's why when people in the community are wearing masks, not as important. Washing your hands and reducing the amount of hand touching to the face is important. In regards to other things that people can do, it is in regards to in regards to the quarantine. When people are in the, well, let me back up. Two different types of quarantine. If you are someone who has symptoms and there's thought that potentially you do have coronavirus, you haven't been tested yet, but you're not sure, that person should have very strict sense of quarantine versus those students who are at SAR. It's been a number of days. They haven't had symptoms yet. Yes, they are still on quarantine, but it doesn't have to be as strict. But we still recommend there is not sharing of utensils. There's not sharing, the beds. There's not, sharing toothbrushes, anything like that, sharing cups. And that should be watched very strictly. People have questions about school closings. Is it helpful? Why are we doing it? It's extremely disruptive. It is 100% disruptive, and it is also helpful. There have been studies that looked at the mathematical model of school closings, and it reduces the amount of infection around 25%. And what we have seen in Italy is there's been a skyrocketing of truly sick individuals, and it is maxing out their hospitals. Their intensive care units are packed, and they are struggling with the number of sick patients that they have. By putting these quarantines in place and restricting, movement, what you're doing is they talk about flattening the curve. So rather than having a spike of the sick patients, it's going to be a little bit more level, so the hospitals will be able to handle it, which is going to mean ultimately better care for the patients. And then hopefully, if we spread it out a long time, potentially there's going to be some seasonality where the warmth of the winter will potentially affect coronavirus a little bit. So that's just some basic points about coronavirus. I also want to talk about the hotline. The hotline, we've had around 100 people call in. Thank you so much for people who are manning the phones. They're inputting the information for the doctors to review, and the doctors are reviewing it, and then people are calling them back. And then they're highlighting certain cases where if it, it sort of hits certain red flags, then the doctors will call them specifically. So please, if you have concerns, if you have questions, continue to use the hotline, and we will get back to you in some way or another. And then Binny was talking about testing. Testing a week ago, extremely limited because it was only done by the government. Then over the weekend, they started opening up to some private institutions who are doing it, but it is still very, very limited. And also the test that is done still takes around 12 to 24 hours to get done. And so you don't expect results that quickly. Within hopefully the next week, we are going to have a semi-automated method of testing. And at that point, we'll probably be able to do thousands a day. And at that point, there'll be a very different message about who should be tested and who shouldn't be tested. Right now, the individuals who are being tested and have priority are those who are in the hospital and are sick. The next priority are people who are symptomatic and have a known exposure to someone who is COVID positive. Now you could say, oh, we're at SAR, potentially we do. That is a cluster risk. That's not the same risk as knowing that you were with someone who is COVID positive. So the cluster risks will come to the top of the line when we have access to test many more people. We're not there right now. And what I want people to know also, if you have a mild illness, you going out to get tested is putting other people at risk. So unless you are sick, potentially staying at home may be the wisest thing to do right now until there is easier access for testing. I think that's what all we have to say right now. And also pediatrics. In regards to children, we know, and this certainly comes from China, it's coming from Italy, and elsewhere, that children are not as affected. And most of the children are presenting with very mild symptoms or no symptoms whatsoever. There have been 0 pediatric deaths under the age of 10 reported so far. So in regards to our own children and their concerns, it is not so much of a health concern. Where the issue lies with them is they are vectors to potentially spreading it to other people. So if you're concerned about your child, having some sort of symptoms, you're not exactly sure, I don't know if they should be tested, that isn't the time to have the grandparents come over and visit. Because it's the older generation that we're more concerned about. With that, I'll end and then I'll answer questions when they come up later. Thank you.
Thank you, Josh. Thank you very much, and thank you to the whole team for your help. I do think, Dr. Rucker, Josh, first of all, I think there are things that you want to address already that you've been scanning. I don't have to read it for you if you've been scanning it. Go ahead.
Yeah, so some questions that people asked were about symptoms and also time frame of things. So in regards to time frame, we know that the exposure occurs. We talk about a 14-day quarantine. That is really the outer limit of when if someone has been exposed that they will start showing symptoms. But we know what the average is. It's 5.1 days. So at 5 days is when you start showing some sort of symptoms, and generally those symptoms are more what we call lower respiratory versus upper respiratory. Upper respiratory is runny nose, the sniffles, maybe a little bit of a sore throat. Lower respiratory is more coughing or difficulty breathing. And fever. However, the fever may be smoldering a little bit and then rise more, as the illness goes on. So day 5 is when you start having symptoms. Day 8 is when it becomes much more of a deeper sort of respiratory problem, and you have a little bit more coughing, maybe a little difficulty breathing. And unfortunately, if you are in that category where it's going to get worse, day 9 is really where things turn more for the worse, just in regards to sort of conceptualizing the time frame. But we have to remember, so I'm a pediatric ER doctor. My ER is still very busy with respiratory viruses right now. We are seeing lots of kids with flu, with human metapneumovirus, with RSV. They're still coming in with cough, runny nose, and congestion, and fevers. So just because you have a fever and a cough, the likelihood is much higher that you have flu than you have coronavirus at this point. I can tell you we've tested a number of people in our hospital. All of them have been negative, and they are at the higher level of concern, because otherwise we wouldn't be testing them. However, things are going to change. There's going to be, because now that we are many iterations into the infection, it is going to be spreading, and we will be seeing more of it. But the symptoms that we would expect to see are, again, more cough, more fever, less upper respiratory, and also when it comes to GI, vomiting, diarrhea, not that common, around 3%.
Next question, either to Josh or to Danielle, about what we're learning about social distancing versus quarantining in terms of when we do what and what your recommendations are. I know it's a pretty broad question, but if I don't know who wants to start, but whoever goes first.
I guess I'll start. I mean, quarantining is complete isolation, so you have no exposure to anyone. Now that you guys understand the concept of respiratory droplet issues, if you are staying a distance away, washing your hands, then the risk of being exposed is extraordinarily low. Obviously, if you're in a community or in a location where you think people have, the virus, then you want to stay away. And the idea of putting yourself in an environment where there's going to be lots of people and you don't know from where they're coming, that's not being prudent. So a lot of hospitals, a lot of institutions are now saying no meetings larger than 20 should occur. And that's for a few reasons. One, because that's 19 other people that you don't know their history and what has happened, and their health history. And also, if one of them gets sick and they have to say, hey, we have to quarantine from this moment on, that's 20 people that you're quarantining at your institution or wherever you work. So social distancing is keeping distance and minimizing the risk for yourself, but also if eventually you become symptomatic, it's minimizing the risk for others. But it's not at the same level as quarantining.
But just explaining, a lot of people have had a hard time understanding and passing on that understanding to others. So if I'm quarantined and then somebody lives in my house and they're not quarantined, how does that make any logical sense? Can you give some color to that, if it makes some logical sense, or why the decisions are made like that?
Yeah, so I think it's important to recognize the difference between precautionary quarantining and isolation. So the SAR students who were told you have to stay home, not because we know that you are COVID-19 positive, or we know that you had a direct interaction with someone who's COVID-19 positive, but just you were in the school and we knew that there was someone positive in the school. That is precautionary quarantining. So precautionary quarantining is you do not have symptoms. Your risk is higher than the community, but not particularly high. We know the infectivity of COVID-19 is probably not as bad as influenza, but we know from what we're seeing in Westchester, it certainly spreads. So if you yourself are in precautionary quarantining, everyone on your house, everyone else in your home is not quarantined, and they can go about the community and do whatever they want. I know there are some schools, it happened to me. I have one child at SAR High School and two who go to another school. The other school said, we do not want your children at our school when you have one child who is in quarantining. That is not based in science, that's based in fear. But, and other people have had their work do that to them as well. 2 separations from a case being your child is on precautionary quarantine, that's 1 degree of separation. Being the sibling or the parent of that child is 2 degrees of separation. That person is equivalent to the rest of society and isn't really considered at risk or putting anyone else at risk.
Thank you. Sorry, so Josh, came up a couple of times. So we had this one day, there was one day last Shabbat, right, where for the high school kids, the quarantine elapsed for 24 hours until we had the Saturday night phone call, and when they were put back on quarantine. So there were a lot of high school kids who were out on Shabbat, and people are asking, so does the clock reset from then as opposed to going back to the last day we were in school?
Right. I mean, so the answer to that is we're going to find out. Because if people were, exposed, so they could potentially have been exposed to someone. But the thought is people who, had been diagnosed are self-quarantining. So they're being exposed to the community. So what's the risk in the community? It's not high, but it's not zero, right? So the potential is that there may be some people who were exposed. Now, the thing is we're talking about starting school 9 days later, 8 days later. So most people who were exposed potentially should already be symptomatic at that point. So we're not saying, hey, you went to work, there's no positive cases there, but you went out into the world, oh my gosh, like, you know, we have to start 14 days again. It depends upon what community they interacted with and the risk of that community. And, you know, unfortunately, our community is a higher risk than the community at large, but unfortunately, I think we're gonna have to find this out when we see what happens.
Okay. Similar question to what I asked before, but a lot of people are asking it. I live in an apartment. I want to go outside for a few minutes. Like what are the options? Can I go out by myself? Can I go 5 feet? Can I go, you know?
Yes, I mean, this is a challenging question. The hardline answer is if you are quarantined, you are quarantined, right? So open windows. And it's not, when I say that, I don't mean to diminish the impact it has on these people's lives, because I know how frustrating and painful it could be. But the reality is, you know, even though it may seem over the top, what we have seen in the last, you know, week or so is that the numbers have really blossomed in the SAR community in regards to those who become positive. So the risk is there. It is a small risk, and it's a smaller risk for certain individuals and a higher risk for other individuals. But unfortunately, we don't know exactly who is who and you know, the exact risk for everyone. So the answer is, despite how frustrating it is quarantine should be, you know, followed to the letter. But getting fresh air, you know, is open the windows, do what you can.
Okay. Sorry, just trying to take the questions that are coming in. Want to clarify again that and I see it all over the chat, I have lots of different opinions, which we totally appreciate. The decision about whether we will open on the 17th, as we were told a few hours ago, has not yet been made internally. And we will certainly try to do our best to make the right decision, or to get the right input, and then to get it out to you in terms of your planning. Rabbi Hartstock, Rabbi Kroll, if you think there are questions that I missed, please chime in. It's been moving fast. Okay. Questions being done about what we're doing to clean the school. We've actually we got early guidance on that, and we had followed that guidance with our own cleaning crew. And then we actually have a recommendation from the government, and also support from the government, God willing, to do more over the next couple of days. With the permission of my colleagues, to wrap this up, I want to, a lot of questions about asymptomatic people transmitting the virus. Josh, I saw that, I actually missed that. So is the virus transmitted only when you're symptomatic, or asymptomatic also transmitted?
So right now we don't have enough information, but the thought is there probably is a time period before the symptoms start where people do have some sort of shedding. Recognize if you are not coughing or sneezing, the amount of shedding that you are doing is minimal, because it is not sort of being, you know, spread. But our understanding is there probably is a little bit beforehand.
Okay. Thank you. Those of you
and to answer that as well, after you feel better, there have been studies that show that you still have the RNA of the virus in your nose. We just don't know if that RNA actually represents live virus that can spread to someone else. So even though your symptoms have fully gone away, there may be a time period after you feel better where you still may spread a little bit.